डॉक्टर पूनम, ओके मैं शुरू करती हूँ फिर। नमस्ते, मैं डॉक्टर अंजू अपनी सखी डॉक्टर राशि के साथ मिलकर एएमटी के डिजिटल मंच पर सभी डॉक्टर बंधुओं का स्वागत करती हूँ और आप सबके साथ मिलकर अपने प्यारे श्रद्धेय गुरु डॉक्टर हरि सिंह मथारू का स्वागत करती हूँ। सर की सादगी सर की खूबियों में चार चांद लगाती है। सर होम्यो जगत के पारस मणि के समान है जो लोहे को सोना बना देता है। सर हमें अपनी मीठी बातों से ही कितना कुछ सिखा देते हैं, इसका विवरण शब्दों में करना मुश्किल है। सर की सिखाने की कला हमें लाजवाब बना देती है। समय के महत्व को समझते हुए मैं अपनी वाणी को विराम देती हूँ और सर की उत्तम स्वास्थ्य और उज्जवल भविष्य की कामना करते हुए सर को सेशन शुरू करने का आग्रह करती हूँ। वेलकम सर। किंतु एक विशेष सूचना है जो सर से मैं अनुमति लेती हूँ उस सूचना देने की। एक विशेष सूचना है, वह सूचना है सर का सेमिनार। सर विगत 40 वर्षों से जो भी अनुभव का खजाना इकट्ठा किए हैं उसे हम लोगों को देने के लिए ठान लिए हैं, कभी वेबिनार के द्वारा तो कभी सेमिनार के द्वारा। आज आप सब वेबिनार का प्रसाद ग्रहण करें और 19 नवंबर को सेमिनार का। इस सेमिनार में ऑर्गेनाइजिंग टीम ने एक नई फैसिलिटी उपलब्ध कराने जा रही है, या उन्होंने बिल्कुल इसका मन बना लिया है कि मैं इसको ऑनलाइन भी कराऊंगा। उसके लिए मात्र 500 रुपये की छोटी सी राशि देकर आप घर बैठे भी सेमिनार में शामिल हो सकते हैं और यदि आपकी इच्छा है तो लुधियाना भी सकते हैं। लॉर्ड महावीर होम्योपैथिक मेडिकल कॉलेज एंड हॉस्पिटल लुधियाना में होने जा रहा है। 20 नवंबर को सर का जन्मदिन है। सर के जन्मदिन की अग्रिम बधाई और शुभकामना मैं दे रही हूँ आप सबके साथ मिलकर, और मैं आप सबसे आग्रह करती हूँ कि इस सेमिनार को सफल बनाने के लिए अधिक से अधिक लोग शामिल हों और सर की गुरु दक्षिणा अदा करने का सुनहरा मौका न गंवाएं। सर, अब आपसे आग्रह है आज का सेशन शुरू करने का।
थैंक यू वेरी मच। अच्छा, पहले बताइए, माय वीडियो इज क्लियर?
यस यस सर।
हाँ, so light is coming from this side. Is it not disturbing the video?
No.
जी सर। Thank you, Dr. Rashi. You have played a very good role in joining many doctors for the purpose of learning our master's thought. I would like to discuss very few and very simple points with you, because all of you know everything about this. Anything is not new to you, but I would like to share my experience with you. First of all, while seeing the patient, what we have to observe and what we lose in that situation, that leads us in the wrong way to selection. That is the main point, because one wrong step leads to many other wrong steps. Sometimes patients say, I am suffering from this, I am suffering from this. So on what point we have to focus our attention, what our patient demands. We all know about the rubrics, about the application even, everything about rubric, everything about medicine. We have full-fledged our knowledge with all these things. But the question is how to apply this knowledge in practice and where to see the obstacles in the patient. This is our main job. The last time during our class, some doctor asked me, I said about anxiety darken. Doctor said, okay, now he is not in anxiety. How do you take that anxiety darken? Because she has know about her suffering. Why testing? She is suffering from dengue. Now, we have learned from our master, present, predominant, and persisting. That was the persisting state of our patient, which leads her to come us. And that was the actual thing. She don't feel relaxed to know about dengue, but she got idea that anxiety gave her to idea to come where she could get relief. That was the answer for that. So we have learned already about accumulation and elimination. Elimination and accumulation can occur in many ways. One thing which usually we are not recognizing, the one type of elimination that I will discuss here for a while. After that, we will move further for case study. There is a special type of elimination, that is emotional elimination. A patient comes to you for treatment of depression. We give any medicine selected on the current situation of the patient. Suppose the patient may suffer from headache, from body aches, acidity, constipation, sleeplessness, many other things. But from where she got the depression, that was an emotional setback to her. This is example, not a case. After giving your medicine, patient got very angry, used to abuse and beeps many times a day, develop many other things related to emotions. After coming to you next time, after your medication, she narrate all these things to us, to a doctor. and her family members say, your medicine has disturbed her very much. She was not getting angry and she was not weeping at all. She was very polite and not reacting so harshly to others. What happened to her? Don't be worried about this situation because you have hit the right target in the patient's personality. Because she got ill because of emotional disturbance. She was about to bear negative opinions from the others, but she couldn't give her positive reaction to that. Maybe the ailments from domination. We will not go for the rubrics here. Just I want to clear the situation of the patient. When patient comes to you, says getting angry, emotional upset, weeping, this is the positive sign for her because she was depressed very much, not able to react with the negative, but now she has developed that courage, that energy in her to react with the situation. So I was about to say that these emotional eliminations ought to be come out in case of depression or in many other cases also. So let us start now for cases.
सर
Today,
सर एक्सक्यूज मी सर, केस शुरू करने के पहले एक थोड़ा सा छोटा सा हमसे भूल हो गई है। डॉक्टर
जी
अदविंदर जी को कुछ बोलना था तो उनको बोल के
हाँ
फिर
जी,
आप केस,
वेलकम
और
वेलकम वेलकम
डॉक्टर गोपाल पंडित जी को भी कुछ बोलना
जी
था।
जी 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 जी, हाँ जी, वेलकम
तो
डॉक्टर गोपाल
डॉक्टर अदविंदर जी।
जी।
Thank you. Good morning,
हाँ
doctors of AMT. Myself, Dr. Yadvinder Vasudeva. I am General Secretary IHP, Punjab State. 19 नवंबर को हमारे
आप
लुधियाना
अपने
में
वीडियो ऑन कर लीजिए मैम।
हो नहीं रहा। 19 नवंबर को लॉर्ड महावीरा होम्योपैथिक कॉलेज में डॉक्टर साहब का लाइव सेमिनार होने जा रहा है, जिसमें डॉक्टर साहब प्री लंच सेशन में थ्योरी ऑफ एक्यूट्स कराएंगे, पोस्ट लंच में थ्योरी ऑफ क्रॉनिक्स कराएंगे। मेरी आप सबसे गुजारिश है, सर को ऑनलाइन तो देखते हो, लाइव आके मिलो, ठीक है, ट्राई अवर बेस्ट। तो हम इस सेशन को ऑनलाइन भी करा रहे हैं और इसकी रिकॉर्डिंग्स भी दे रहे हैं। प्लीज आप मैक्सिमम रजिस्ट्रेशन करिए और डॉक्टर राशि विल सेंड और डिटेल्स इन दिस ग्रुप आल्सो। मैं डॉक्टर साहब के लिए यही कहूंगी कि ये सच हम्बल पर्सन कि हम इनको लाइव भी सुनना बहुत पसंद करते हैं। दैट्स ऑल, थैंक यू। आप आना जरूर सर 19 नवंबर। थैंक यू
डॉक्टर यादविंद्र वासुदेवा। You have tried your best and with your team we will try to cooperate you. Let us start.
गोपाल पंडित सर भी कुछ बोलना
जी
चाहते
जी
हैं।
हाँ, वेलकम वेलकम।
मैं बहुत स्वागत करता हूँ इस प्रस्ताव का, और हम लोग ज्यादा से ज्यादा संख्या में डॉक्टर साहब को सुने, ऑनलाइन ही सही। जो ऑफलाइन जाना चाहते हैं तो उनके लिए तो है ही, ऑनलाइन भी अच्छी बात है। मैं इसका समर्थन करता हूँ। धन्यवाद।
थैंक यू डॉक्टर।
Let us start. Should we start now?
जी सर
Okay. Today, I think our master has given the beautiful words for us, beautiful knowledge for us. Dr. Emil Segal has explained beautifully how to learn the mind technique and how to apply the most common usual expressions of the patient for the purpose of our selection of the medicine. Today, I feel happy to share with you the first example given by Dr. M.L. Sehgal sir with you. At that time, sir was studying Kent Repertory and he has taken rubrics from the Kent Repertory because now many repertories has come into existence with many other medicines in the previous existing rubrics. And Dr. Jogesh Sehgal has solved this problem in his perfect repertory. So this was the case. A patient came to sir for pain in earache. This is the example of Dr. M.L. Sehgal sir, not mine. He came to sir that I am having this ear pain from the morning. I didn't bother this pain. I tried to chew my food very carefully so that pressure may not exert on my ear. But now I am thinking that night is coming. If I will get some pain, it may aggravate it at night. I will disturb my family. Please give some medicine. This was the case only. A very, very beautiful example. Most of the time in our life, this is example not for only earache, maybe for many, many other sort of sicknesses. Many people, most of the day, people ask us, come in the evening, sir, give some medicine to me. My problem may increase at night. I want this before coming it. I want to manage it earlier, before coming it. This is a common example. This is a very common expression of the patient. Very, very common. Sir gave the medicine for the patient. Britacarb was the medicine that was analyzed from Kent Repertory. Today, many other drugs introduced, but other symptoms of the britacarb, the rubrics of the britacarb will eliminate that medicine also. But at that time, britacarb was given to the patient. After giving britacarb to the patient, the discharge from ear take place. After the discharge, patient feel great relief in his problem. Because this is the most common example. Generally, we people see this expression in our daily life. So this was the first case. Sir has blessed us how to enter the case by using common expressions, usual expressions of the patient. Really, we are very fortunate one because many things the patient usually say this happened and just discuss about his problem to his doctor were ignored before Dr. Sehgal. My problem may not increase. We were not bothered about this problem. Sir has put that expression. This is increasing now in fear extravagancy. Sir, can I cure? Is there any treatment for this? Sir has put this in life desire for. Sir, it is confirmed. Can I be treated? Can I get benefit with the treatment? Sir has taken this expression into right desire for positively. We are lucky. So many expressions of the daily patient which were ignored before Dr. Sehgal are become a trigger for us. We can unlock the very chronic locked patient with the common usual expressions. This is the beauty of mind technique. Rather, I would like to say Sehgal technique from the classical homeopathy. In classical homeopathy, we used to take particular peculiar symptoms, thermal, aggravation, all these things. But Sir has given us that beautiful tool just to consider common usual expressions into practice to solve the case. So this was the first case given by Dr. Sehgal. The Bretta-Car was the medicine. Now we will start our again next case.
सर प्लीज रूब्रिक्स बताइए वेरियाटा का केस में.
जी हाँ ओके, मैंने शायद बताया नहीं है. हाँ ओके. Patient told the doctor, I didn't bother about the earache. This was fabulous. Patient felt in evening before night coming, before my problem aggravate, he want to manage. This is cautious. Patient says, my family may suffer with my sickness. This is anxiety others for. Patient says, while chewing the food, he was avoiding the pressure on the particular affected area. That was carefulness. When we analyze all these rubrics with Kent repertory, only Bretta-Car will come. Nowadays, many other medicines have added. Sulfur is also coming with that, but other rubrics and other expression of the patient will lead to Bretta-Car only, because Bretta-Car cured the patient. This is the perfect proof for us, because the patient of Bretta-Car. Next. a very simple and important case. A lady came to me. She was of age about 39. She was talking, "Sir, I am living in depression. I am very much unhappy in my life. Please give me some treatment. There are many problems which I usually suffer daily." I was married 10 years ago. My in-laws family tortured me very much. They didn't allow me to do nothing accordingly to my intention. They tortured me. They give me unnecessary punishment. If I made simple mistake in my family, they tortured much in proportion to my mistake. They insulted me in front of my whole family. My mother-in-law, my father-in-law, and my sister-in-law abused me. They make me very sad by saying me, "You are a fool." Sir, sometimes I have feeling in my mind. I feel great anger with those persons. I want to injure those people. All the behavior of my family has made my life stagnant. My hairs have fall and my hairs become grey. All those people are leading their life very well, but I have lost my beauty also. Those people behave with me very bad. This was the case. She told me all her expressions, all her all her feelings to me. I decide the importance of what she was saying and that expressions into rubrics. I gave her medicine for because there was much acidity in her abdomen, stomach, great fullness, great weakness. She was not able to cope up with her daily routine easily. All these expressions led me to know about some remedy. I gave a medicine for her. I called her patient just after 20 days because this was the very chronic problem. So she may get some relief with some time. so that I would see her after 20 days. After 20 days, patient told that she's having good relief in all her problems. Sir, one thing is very good for me. At that time, when the people used to abuse me in front of my family, I was not saying anything to those people. But the anger was in my mind. I want to hit those people. According to my understanding, I make some rubrics for her. I will let you know about the rubrics. Ailments from abused after being in marriage. All the problems which she has narrated in front of me was the result of misbehavior in her in-laws. The first rubric I took ailments abused after being in marriage. Ailments from punishment. Unjustified behavior to the patient. Ailments from mortification. Delusion torment he is. Delusion hindered he is by everyone. They people don't allow me to let me live my life as I wish. This is delusion hindered me just creating obstacle in the harmony of life, in the harmony of anything, any act. This is hindrance. Anger stabbed anyone so angry that he could have stabbed. He was thinking, I could injure those persons. But I save myself and I retain myself for doing that. China in 30 pregnancy was given to her. Now 6 months have passed. I had not repeat any medicine or not even change the pregnancy. The patient is much better. She was suffering from hypothyroidism. She told me when she came to take medicine from me for her the treatment of depression. But after 3 months, she showed me the test. Sir, my TSH level is coming down. So I have not checked TSH again because that was not my issue to treat. She came for me for depression. Depression totally gone. Her face was glowing, and I'm sure her TSH level will totally come to the normal. But China was given the medicine to that patient. We will discuss any questions after our reading process because it may disturb my flow. I will discuss all these things. Just taking next case because I have to go at 9 o'clock. A very good patient, a child, was took to me by her mother, female child. Her parents complained that my child don't allow me to touch, don't allow anyone to kiss. Many people comes to us, our relatives, our family friends. When they try to kiss, she repels. We kiss, she don't repel. And when we took the patient from the cradle, she feel upset, very upset. Sir, our child is not developing properly. Sometimes we feel she's not behaving properly as she should according to milestones. She's 5 years now, but those things which child should behave according to this age of 5 years, she is not behaving like that. Her height is not up to the mark because she is not taking diet properly. Pediatrics has told that she may suffer from autism. Some people say she's suffering from autism. Some people say there is no autism, but she may suffer from autism. She may not suffer from autism. That is not the question for us. We are going to treat our patient. He may suffer from any problem. The name given to the disease by allopathic system has no value for us. So I took those symptoms and I gave medicine 30 potency to that patient because she was suffering from so long. I give medicine for her for the patient for at least 20 days. After 20 days, her mother took that patient to me. I knew from her expression the child was smiling in the proper way. The look of the face of the patient was improved on this time. Earlier, I have discussed about some case that the look of the patient will change. Whenever medicine is right, look of the patient will change. Her behavior will change. Some objective symptoms will guide us that our patient is improving. And her mother told me, sir, a good change we have noticed that when our family friends, our relatives came to us, they tried to kiss her, she was repelling. But now my brother came to my house. He took her from the cradle in his lap She didn't relapse. She didn't repel. She didn't show any bad expression. So this was the good improvement in the patient, and she has tried to eat properly. She's eating good, taking milk and taking some other eatables properly. So I took some symptoms. The medicine given to the patient was calcarea was in 30th pregnancy. I took first symptom, caressed being aversion to being caressed by strangers. Carers being aversion to being caressed strangers. Whenever any other other member apart from her family used to lift that child, she shows this negative behavior. And another rubric I took was anxiety in children when lifted from cradle. This is just opposite to Borax. Borax patients feel anxiety or fear putting downward to the cradle, but this is upward to the cradle, just opposite. Anxiety children in lifted from the cradle when. Another rubric, carried, desired to be carried when only family members. Development of children arrested. Many times I took this symptom for the patient. This gave me good result when other mental symptoms cooperate. So calcarea was in 30 pregnancy given to the child. I am repeating the rubrics again. Caressed being aversion to, strangers being caressed. Anxiety, children in lifted from the cradle when. Development of children arrested. Carried has to be carried. This symptom just was not of much important. What the child was seeing towards her mother for being carried. So that I apply this rubric in this case. So we are very near our time. After discussing one case, we will discuss about the queries. Very simple case. Patient came to me. The very poor person was labor. He was working for some thekidar in house of my patient. Doctor told that patient, please took him to another higher hospital for platelet transfusion. This one was very poor. Patient told me, sir, last year my father was admitted to the hospital, the same hospital where I gone. He was transferred to the big hospital. We have spoiled our money up to 50,000. Sir, we are very poor people. I can't bear that. This lady, it was my patient. She has recommended me and she took me to you. Sir, give me treatment. I said, what is your problem? Sir, I feel great weakness. I'm lacking energy in myself. I can't put my hand even. So I give very good remedy which were given by our master, and I mostly said that this is a Paras Bhatti for us, Belladonna 30. His symptoms were feeling great weakness, so delusion poor. My father was admitted to the same hospital. We have suffered the problem very much. We have wasted our money. I don't want to face the same problem. This is the superstitious. Again, another rubric. My patient told to that patient to come with her. He easily agreed and came to me. That was credulous. One more expression of belladonna. This is the very common expression. Sometimes I give the expression of Morenia, Naxmamka and Chamomilla. The one very important expression which I could realize in my practice, that is, patient says, sir, just you improve my appetite, otherwise I will be okay. Otherwise there is no problem. You remove this, I am okay. You treat this, I am okay. There is no problem. This is the most common expression of the belladonna. Please don't miss this expression. This expression will lead to the accurate prescribing belladonna and will not.
Sir, repeat कीजिए ना expression.
Yes. Just you treat my appetite. I am feeling this feeling. Any problem may be. This is the example. You give me appetite. Otherwise, I am okay. If this problem is removed, there is no problem. Many expressions relating to this expression, but these are the very common usual expressions which I am giving you for belladonna. This is the belladonna. I give belladonna to the patient, and I have his tests in my phone. The patient's platelets count was 14,000 and TLC level was 1700. After giving the medicine, testing after 3 hours, he raised the platelets 21,000. After that, the test is not, you can say, I have no test report, but patient is quite okay now. This is the very, very common rubric, very common expression of the patient. Please don't forget these things into your practice. For today, this much I would talk.
Sir, one thing, good morning, sir. Sir, what was the second rubric one?
Second rubric, in this case, superstitious, because his father was admitted to the same hospital, the hospital which he came. This was the superstitious thought. It is not necessary that his father has suffered from the problem. He may also suffer, but this was the thought in his mind. I may not suffer. During a period,
impressionable भी आ सकता है.
yes, reasonable, maybe reasonable, but I took it.
Impressionable भी आ सकता ना सर.
Yes.
गुड मॉर्निंग सर.
जी.
सर जैसे आपने अभी बताया कि बेलाडोना का ये एक्सप्रेशन है कि वो बोलता है कि मुझे ये ठीक कर दो. कभी कभी ऐसा होता है कि हमें कोई और प्रॉब्लम दिख रही होती है पेशेंट में, लेकिन उसे ये है कि जो उसकी प्रॉब्लम है, मान लो उसको लग रहा है कि मेरी स्किन ठीक कर दो, लेकिन उसको प्रॉब्लम एंजाइटी की है, तो उसमें भी वो जो एक ही चीज के लिए लेता है, तो उसमें वो भी बेलाडोना का एक्सप्रेशन आएगा.
हाँ, उसमें क्या होगा, हमने ये देखना है कि पेशेंट स्ट्रेस किस चीज के ऊपर देता है. उसको स्किन की प्रॉब्लम है, उसको और भी प्रॉब्लम है. अगर पेशेंट का माइंड इसके ऊपर टिका हुआ है कि अगर सर आप इसको ठीक कर दो ना, तो आई डोंट bother about any problem, I am okay, then you can give belladonna in any problem. I have tested this expression many times in my practice. So this is a very good key, I think, because I have tested. You can test this.
गुड मॉर्निंग सर.
जी.
ये जो एक्सप्रेशन है, ये रूब्रिक्स क्या बनेंगे इसके सर? सिर्फ ये हमें ऑब्जर्व करना है, किसी एक कंप्लेन पे फोकस हो जा रहा है पेशेंट, और बहुत सारी कंप्लेन है उसको, लेकिन कह रहा है कि मुझे पहले यही ठीक कर दो और इसे आप ठीक कर दो.
पहले नहीं, आपने यूज कर लिया पहले का लफ्ज, इसमें वो लफ्ज नहीं यूज करना. जो मैंने एक्सप्रेशन दिया है वही, सर अगर आप इसको ठीक कर दो ना तो मेरे को कोई दिक्कत नहीं है, ऐसा पेशेंट बोलेगा आपको. जैसे पेशेंट मेरे पास आया, जिस पेशेंट की मैंने अभी बात की आपके साथ, डेंगू का पेशेंट जिसके 14,000 प्लेटलेट्स थे, उस पेशेंट ने क्या बोला, सर मेरे को भूख नहीं लग रही है, यहाँ पर ये सब हुआ है, अगर ये ठीक हो जाए तो सब कुछ ठीक हो जाएगा और कोई प्रॉब्लम नहीं है. ऐसा
डिल्यूजन पुअर और डिल्यूजन वेल्थ का कॉम्बिनेशन है.
हाँ, दोनों का कॉम्बिनेशन है, और फेबुलस भी है. He is not bothered about any other problem, or she is not taking all the problem not too seriously. इसमें आप कितने भी रूब्रिक लगाओ बहुत आ जाएंगे, बट एक एक्सप्रेशन को ही याद रख लो, वही बहुत है. अगर ये एक्सप्रेशन आपने देख लिया तो आप किसी भी लॉक को अनलॉक कर पाओगे, वो पेशेंट किसी भी प्रॉब्लम का हो, नो क्वेश्चन.
आपने जो ऑटिज्म का केस का बोला ना,
कैलकेरिया फॉस वाला, हाँ जी,
हाँ कैलकेरिया फॉस वाला. सो एज यू सेड दैट कि वी शुड नॉट कंसीडर व्हाट इज द नेम ऑफ डिसीज, आप जैसे बताए, तो इन दैट ओनली आई एम गोइंग टू आस्क यू क्वेश्चन दैट कि मुझे पूछना है कि अगर पेशेंट मतलब 5 years का है और ही और शी इज नॉट मिक्सिंग अप विद सराउंडिंग, तो उसको कंसीडर किया गया है कि वो ऑटिज्म है करके, तो फिर उस टाइम पर हम लोग को कैसा करना है?
डॉक्टर साहब ऐसा है कि वो ऑटिज्म है या ना है, हमें इसके साथ एज ए डॉक्टर, एज ए होम्योपैथ, वी आर नॉट कंसर्न विद दैट. पेशेंट इज कंसर्न विद द डायग्नोस, बट वी आर नॉट कंसर्न बिकॉज वी हैव नॉट ए स्पेशल मेडिसिन फॉर ऑटिज्म. Therefore, we have to consider all the symptomatology according to our mind technique, the usual common expressions. This is my, you can say, answer to your problem.
आपको इस बात अपने केस में, हाँ बोलिए, वो डेवलपमेंटल अरेस्ट आपने लिया ना, डेवलपमेंट चिल्ड्रन,
वो मैंने इसलिए लिया क्योंकि पेशेंट बोल रहा था, मेरे को भी लग रहा था और डॉक्टर ने भी बोला था कि इसकी हाइट अप टू मार्क नहीं है और इसका वेट भी अप टू मार्क नहीं है, और ये जिसको जैसे इसको अपना टॉयलेट वगैरह जाना, यूजुअली यूरिन वगैरह जाना, जो उसका नॉर्मली उसको करना चाहिए, वो उतना एक्यूरेट नहीं है. इसलिए मैंने उसको लिया था डेवलपमेंट अरेस्टेड, कि वो डेवलपमेंट उसकी अरेस्ट हो गई है, वो पूरा फुली अकॉर्डिंग टू एज वो डेवलप नहीं हो रहा ऐसा।
सर गुड मॉर्निंग।
में केयर एवर्स टू बीइंग बाय स्ट्रेंजर्स, ये रूब्रिक मिला नहीं है, कहाँ है
ये केयरलेस बीइंग में मिलेगा आपको, उसमें अवर्स नहीं है।
मोबाइल में है सर, मोबाइल ऐप में है सर, मोबाइल ऐप में है, रूब्रिक है
जी, है उसमें। हाँ
सर
जी,
गुड मॉर्निंग।
सर मोबाइल ऐप में है सर,
एक कर।
सर एक रूब्रिक है ऑटिज्म, ऑटिज्म एक रूब्रिक है, वहाँ उसको कहाँ पे हम यूज करेंगे?
उसको कहाँ पे करेंगे? उसको ऑटिज्म में ही, और कहाँ करेंगे हम? जो ऑटिज्म दिया है हमारे मास्टर्स ने, तो हम उसको कर लो। अगर उसके साथ आपके जनरल सिम्टम टैली कर रहे हैं पेशेंट के उन मेडिसिन के साथ, तो वो मेडिसिन काम करेगी। अगर नहीं तो जैसे मैंने एक केस भी आपको बताया था, शायद आप कौन बोल रहे हैं?
डॉक्टर मधुस्मिता सर
जी, तो शायद आपने सुना होगा, बहुत देर पहले मैंने तूजा का केस दिया था ऑटिज्म में।
जी सर।
और उसमें मैंने वो सिलेक्ट किए थे सिम्टम। एक था एलिमेंट्स आफ्टर वैक्सीनेशन भी मैंने लिया था, क्योंकि जब पेशेंट को वैक्सीनेशन दिया गया उसके बाद उसका ये बिहेवियर डेवलप हुआ। वो लंदन से था, मैंने बहुत साल पहले, शायद काफी देर पहले मैंने ये केस डिस्कस किया था हमारी क्लास में। तो उसमें मैंने ऑटिज्म प्लस ये सिम्टम भी लिए थे और अदर सिम्टम भी थे उसके साथ। ऑटिज्म का सिम्टम आप ले सकते हैं, बट
सर हम गुड मॉर्निंग सर, डॉक्टर अनीता। ऑटिज्म का रूब्रिक जैसे अभी मैंने फोन में चेक किया, उसमें बहुत कम रेमेडीज हैं
जी।
सो आई थिंक वो बहुत लिमिटिंग हो जाएगा अगर हम
वही तो बात है ना,
कि हम हर ऑटिज्म के केस में वो ऑटिज्म का रूब्रिक ले लें। आई थिंक दैट विल बी वेरी लिमिटिंग बिकॉज देयर आर वेरी लेस मेडिसिन इन इट।
हाँ, आपको ब्रॉड स्पेक्ट्रम में आपको उसका बिहेवियर नहीं छोड़ना चाहिए। अगर वो मेडिसिन कवर नहीं कर रही तो यू कैन से आप ऑटिज्म को तो छोड़ सकते हैं, लेकिन जो उसकी प्रेजेंट सिचुएशन है, जो उसका प्रेजेंट बिहेवियर है, उसको नहीं।
सर ये मुझे नहीं मिला है वर्जन 2 केयरलेस बाय स्ट्रेंजर्स।
अवर्जन नहीं है उसमें, पहले केयरलेस में देखिए आप।
पूनम आई हैव सेंड द स्क्रीनशॉट, यू सी इट लेटर।
स्ट्रेंजर्स
टॉक विद मैथरो, हाँ स्ट्रेंजर्स वाला फोन में है।
वो पेशेंट, मैं आपको सीधा बताता हूँ, वो पेशेंट जब उसको बाहर वाले लोग उठाते हैं ना, तो वो उठना उनके साथ नहीं मिक्सअप होता, वो उठता नहीं है, वो उनको ना रिपेल करता है, उनको अच्छा नहीं लगता उसको कि कोई दूसरा उसको उठाए आके उसको प्यार करे। वो अक्सर ऐसा होता है ना, घर में जब आते हैं लोग तो बच्चे को उठा के प्यार करना कोशिश करते हैं, हम सब करते हैं। तो पेशेंट वाज नॉट अलाउड टू द स्ट्रेंजर्स।
One minute. Exact rubric is carest being aversion to strangers, being carest by.
हाँ, यस, ये है।
तो 2 मेडिसिन है मोबाइल में, कैलकुलेटर में।
आपकी आवाज थोड़ी सी फट रही है, थोड़ा सा धीरे जब बोलिएगा। कैसे, क्या बोल रहे हैं आप?
2 मेडिसिन है इसमें, कैलकेरिया फॉस और नेट्रम्यूर, ये बोल रहे हैं सर।
तो पूरे रूब्रिक लगाइए ना आप, अगले वो भी तो लगेंगे ना इसमें। नेट्रम्यूर तब आएगी जब एक ही रूब्रिक लेंगे आप। एंग्जाइटी चिल्ड्रन लिफ्टिंग फ्रॉम द क्रैडल वैन, वो जो जस्ट अपोजिट है उसके बोरेक्स के।
सर यदि
बोरेक्स को नीचे डालने में तकलीफ होती है, इसको ऊपर उठाने में होती है। बड़ा अच्छा डिफरेंस है।
सर यदि कोई ऑटिज्म का केस 30 इयर्स की एज में आया हो तो उसमें भी क्या यही रूब्रिक लगाएंगे? यदि कोई स्ट्रेंजर उससे बात करता है तो वो रेडी नहीं
अगर है
होगी?
तो रूल लग जाएंगे, उसमें कोई रिस्ट्रिक्शन नहीं है। एज की तो कोई रिस्ट्रिक्शन है ही नहीं है हमारे पास। अरे सर, वो डॉक्टर साहब, ये तो पशुओं में भी लगते हैं। मैंने इन एनिमल्स आई अप्लाइड साइक्लिक टेक्निक देयर विद वेरी गुड रिजल्ट्स इन एनिमल्स। तो बच्चा जो बोल ही नहीं सकता उसमें भी, एनिमल जो नहीं बोल सकता उसमें भी, दिस इज द ब्यूटी ऑफ साइकिल टेक्निक। Our master has given us the great key. We can open many locks with this. I would like to say any lock. कहीं भी लगा सकते हो आप, एज की रिस्ट्रिक्शन थोड़ी है। हाँ जी
सर, जो आपने डिफरेंस बताया वो बताइए एक बार, जो किसको
क्या?
उठाने से, ऊपर उठाने से अच्छा लगता है।
हाँ, वो उसमें डाउनवर्ड मोशन का फियर है ना, फिर डाउनवर्ड मोशन का है, इसको ऊपर उठाने से लगता है ना, जो लिफ्ट करेंगे तो आप ऊपर को उठाएंगे ना, नीचे को थोड़ी करेंगे हम, ऐसा जी।
Can you please comment upon the potency repeated in calcarea FOS? How many doses were given?
डॉक्टर साहब ओनली सिंगल डोज दी है मैंने, सिंगल डोज का ही रिजल्ट है। थूजा जो पेशेंट को दिया था उसमें मैंने 3 डोज दिया था। पहले मैंने थूजा दिया था 30 में, उसके बाद मैंने थूजा 200 में दिया, उसके बाद मैंने उसको 1 m दिया। वो 1.5-2 साल में पेशेंट क्योर्ड, टोटली क्योर्ड है, वो अच्छा बच्चा पढ़ रहा है, कोई दिक्कत उसमें नहीं आई। उसके बाद उसमें 3 डोज दिया है, इसमें 6 महीने हुए अभी, इसको मैंने 30 पे रखा हुआ है और 30 से वो पेशेंट तकरीबन क्लियर हो गया है। नेक्स्ट टाइम अगर थोड़ी बहुत दिक्कत आई, कैसी बढ़ानी भी पड़ सकती है, घटानी भी पड़ सकती है, वो कैसा सिचुएशन आएगा, बट ऑलमोस्ट पेशेंट इज क्योर्ड।
राइट, थैंक यू सर।
जी
सर, नीरज गुप्ता सर बिहार स्कूल प्रिंसिपल है सर।
ओ, ये डॉक्टर साहब थे, अच्छा।
हाँ जी 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 सर।
ओ हाँ डॉक्टर साहब, वेलकम
वेलकम
आपने
सर,
तो
वेलकम।
बहुत ही अच्छा प्रयास किया था इस होम्योपैथी के सेमिनार को, आपने इतना अच्छा रिस्पॉन्स दिया सर, आई थैंक यू अगेन वेरी मच।
You're welcome, sir. We are obliged that you are creating so much awareness about the mind school, and
Thank you, sir.
we are learning. Thank you.
Thank you, sir. This is all because of your cooperation. Because in VR Sur, your college, you have cooperated us very much.
So we are all
thanks again. जी सर। हाँ जी, another question. Should I leave now?
Thank you so much, sir.
Okay, आज के लिए इतना ही।